And so CPT is just a workhorse of getting unstuck, right?
Yeah, absolutely.
It just is. When you think about, there's many different kind of tools as you work through it. Is there a kind of fundamental skill set or a strategy where you just find this to be super effective, if not your favorite part of the treatment? What really stands out to you in terms of cognitive therapy and how to get unstuck?
The core skill of a cognitive therapist is Socratic dialogue, Socratic questioning. It is intentional, directive questioning and challenging of these thoughts, of these beliefs. And what we do is, first we investigate the beliefs and we map them out. Where did that belief come from? What's the consequence of that belief? We make sense of it. What's the impact of it? But then we also kind of want to tear down the walls around it a little bit of, well, let's kind of go back in time and say, where did it come from? What was the information at the time where this thought was developed? So I think a lot about kind of input, event, output. So we have to dig into kind of, what did you used to tell yourself before this, right? What changed? And sometimes that thought was, the seeds were already there, right? I was already, I grew up in an environment where it was very distrusting, or the world was dangerous. I was very self-reliant. This event happened that really just strengthened, solidified that belief. Or it could be, I had the opposite experience. I grew up in a safe place, a warm, loving environment. All of a sudden, this really bad thing happened, and I learned, shit, I was young, I was naive. That's not how the world is. This is how the world is. So we have to pay attention to what happened first. And then we have to say, well, what was going on at that time? And at the time of the event, there's a lot of what was the information you had at the time. We naturally, we are our own toughest critics. And we live our lives in the rear view. And especially when we have these really impactful events that we want to make sense of, we don't want to let it happen again. That's one of the biggest things, right? Is we kind of set this new set of rules based on the worst possible thing. And we organize it, and we make sense of it in a way where it feels like this is really normal. And this is the way it is. And it's hard because it's such an outlier, right? It's one piece of evidence with massive consequences. So thinking about that and kind of going back to, in that moment, well, why did you do what you did at that time? What information did you have? What options did you have? Why didn't you do those options? It's a really important part of that kind of questioning, just information gathering. And then kind of going from there, well, what is the deeper meaning? What's the interpretation of what I did do? I spend a lot of time looking at, well, what's the influence of, we frame a lot of things, and I'm as guilty of this as anybody. We emphasize a lot on character, right? I screwed up because I'm a bad person.
That's right.
I looked like an idiot because I'm an idiot. Every failure of mine is because of a deep flaw in me. We don't do that on the other end, right? Things that are great and achievements. I actually feel really uncomfortable with achievements, and I'm like, oh well,
Harrison,
they get all the credit.
It's because you're a great person and you deserved it. You've worked hard.
Of
course.
So so we all do this, right? And I think that that's a really important piece too, is that zoom out. Would you evaluate yourself the same way you would evaluate somebody else? Right. And I think that's a really big piece of trauma recovery. What would you say to your buddy? What would you say to your sister? What would you say to your loved one in the same situation? And my guess is you would talk to them really differently than you would talk to yourself. So I think we overemphasize character and we underemphasize social factors and the context in which it occurred.
When we view this, Socratic questioning or Socratic dialogue, the skill involved in this, because you can easily come off as you're putting people on the spot, or, you know, really targeted questions. As you were talking about it, as you're describing it so skillfully, and people who are listening who aren't familiar with it, I was just curious, like the pitfalls that might happen, or the skill in being able to do this kind of questioning in a way that people don't get those defenses up or feel judged. Anything coming to mind as I say that? Yeah.
It is hard. I think one thing is you have to approach it from a place of genuine curiosity.
Yeah.
Right. And on one hand, as a therapist, my questions aren't random. Do I have an idea of places I want to go? Sure. Do I pull on threads kind of with an idea of what's a step ahead? Sure. At the same time, there's I'm really curious. Where's that thread going to lead to? Mm-hmm. And I'm totally comfortable with, I'm going to pull on that thread. There's going to be nothing there. I'm pulling on another thread.
Right.
So we're kind of like, there's this little dance of like, we're going in and out, we're probing different things. I'm constantly kind of taking that stance of, I'm not an expert in this. I want to learn more about it. And I'm going to hypothesize and test throughout. So I really take that approach. Mm-hmm. So it's not random. It's not just, oh, we're just going to ask questions for the sake of asking questions. They're not random questions.
Yeah.
But I have to be really careful not to get locked in on my line of inquiry. And if I'm wrong, I have to own that. I have to back up. Because if I start doubling down, it's just a fight between me and you. And it's, no, you're telling yourself this. That's not going to get us anywhere.
That right there. And the curiosity and the openness to say wherever it leads.
Yeah.
And I've found it in myself. I'm asking questions with answers that I'm expecting them to get to. And that is not genuine openness. It's take a step back, realize that, apologize if you need to. Hey, let's explore this kind of thing, and let it unfold. So with this core skill then of, you know, Socratic dialogue, Socratic questioning, with the people that you've worked with, right, doing this, you know, treatment, working with PTSD, what impact have you kind of seen when you use this and it progresses over time? Yeah, just how has this impacted the lives of the people that you're working with?
I think it's a huge impact. You know, I think what we see is that people who do these treatments, the expectation is they get better, and the expectation is they stay better. You know, again, I kind of talked about just like that weight that we put on ourselves, and the weight of self-blame. It's my fault. It should have been different. Mm-hmm. That's really heavy. We carry that for a very long time. And I view it as we punish ourselves. And again, my end point is not pat yourself on the back for a job well done. Aren't you a better person because of this? Isn't it a good thing this trauma happened? That's not what we're doing.
Nope.
I really like ending up in a place of trauma was the worst thing that ever happened to me. That was the worst event I've ever experienced. Mm-hmm. And it was really complicated. There were a lot of different factors to it, a lot of things that can bind into it. Maybe I did some things perfectly. Maybe I did some things not so perfectly. Mm-hmm. And that sucks, right? And oftentimes my end result is feeling loss, feeling sadness, feeling disgust, you know, maybe some negative emotions. But I think emotions that are fitting and that, you know, I talked about sometimes it makes sense just to feel emotions.
Yep.
I think those are some good emotions. Sometimes we just got to feel them. If we lose somebody in our life, grief and loss is probably just natural, healthy response. It's probably good to feel that than to avoid it, to push it away. Avoidance is a big part in PTSD, substance use, I think mental health as a whole.
For sure.
So yeah, I think that's, I see a huge impact of it. I'm also a big believer in short episodes of treatment. I'm not you're in therapy forever. Mm-hmm. I always get so again, I'm not everybody needs to be in therapy type of person. Mm-hmm. I think you need to have specific treatment goals to work on.
Yep.
That's really big. And I think you should be meeting those goals. And if you're not meeting those goals, you probably shouldn't continue the treatment you're doing forever. So when the practice that I do, it's a goal focus, right? At the beginning, early on, I'm very focused on what do you want to get out of this? Like, and let's make it targeted. And we can set the bar high, right? Let's do things like, no way I'm doing that. Like, we're fucking doing it.
That's right. That's right.
So I like to do that. You know, we'll have some short, medium, long-term goals. But I like some big goals, things to shoot for. And we're working on them. We're chipping away at them. And at the end of that treatment, it's not, well, oh, it's 12 sessions, therapy's up. Like, my goal throughout is I want to remove myself from the equation. Do I have skill and expertise in what we're talking about? Recognizing thoughts, challenging those thoughts? Absolutely. I think I bring something to the table. I have value in the therapy room. At the same time, I don't think that you need me forever. I think come in, use me as a consultant. I'll train you in this. And at the end of therapy, it's not, oh, you're fixed and everything's perfect now. It's you have the skills, you have the tools to continue working on this yourself and being your own therapist. In the treatments I do, I use a lot of worksheets and exercises. And it's, we kind of build up and train people to do this Socratic dialogue to themselves, where instead of me asking those questions, I'm going to teach you to ask yourself those questions. I'm going to teach you to evaluate. And that applies to old things and that applies to new things. And that applies to my own life, right? I think I've asked other people those questions so many times that I've kind of internalized them. And I ask myself those questions. And I do those worksheets in my head on the regular. And I think it's really helped me.
Yeah, I mean, and on that point too, I mean, so often, I don't know if it's just my baritone voice, but you must hear like, oh, I just hear you in my head now. That's the shift that happens. And it's not that this is all roses and it was totally fine. Oftentimes it's not, but there's not the stuckness. It's not the shame and the guilt, or that's gone down to a place where you can still move and feel what, those natural emotions, sadness, all those things that tend to come up. And at the end of it, I love that. I mean, maybe it's your influence, but I talk the exact same way. Is these are about tools and it's a process. This is not a one and done, but now you have these that you can start recognizing these patterns, and it's no longer this huge barrier. And this is just part of the human condition. But now, before and after, you basically are, if not your own therapist, you have the tools that we were working on. And there's nothing magic on this side with me. It's just, that's kind of the process, right?
Yeah.
And importantly, I've heard like child psychologists in particular, when people have asked them like, how has this impacted you as a mother or a father? And a lot of people are like, well, not really at all. I'm listening like, really? All that? And so that thing you touched on at the end of, and this has impacted your own life. I know for me, learning this stuff, it's a huge impact across areas of my life. But for you, what have you noticed in terms of when this comes up, how it's influenced you day to day doing this for as long as you have?
Yeah. I mean, I think it applies big and small, right? I always kind of think about zooming in, zooming out. And from the get-go, I think, my practice, my my training, all of that always kind of applied to, these various situations in my life. Just, small day-to-day stuff. Like, why am I getting all worked up about this? You're in grad school. Everybody has anxiety.
Yes, they do.
I'm a moody millennial, just like all my other peers, right? So we all have, and, so that's all kind of small stuff. I'm not going to go too much into this, but I had a unique experience of, I was not a trauma survivor going in when I became a trauma therapist.
Yeah.
However, today I am a trauma survivor.
Yeah.
And it's hard to say, well, how would I have responded to that differently if I didn't have this background, if I wasn't thinking about it that way? But absolutely, while it was unfolding, and in all the aftermath, and today, a couple years later, I absolutely did worksheets in my head, right?
Mm-hmm. Yeah.
And I didn't always have to do it in a totally formal way. Again, because I think I have bits and pieces, and I think that I just naturally do it all the time, and I couldn't help myself from doing it. Even if I didn't want to do these worksheets in my head, I'd be doing these worksheets in my head.
That's right.
And a big part of these worksheets, I'm talking about worksheets in this very vague way.
Yeah.
We map our thoughts. What am I telling myself? What's the impact of what I'm telling myself? We kind of put it on trial. What's the evidence for and against it? Am I exaggerating? What am I leaving out? So, it's normal of, when we're making an argument for something, we tell one side of the story. It's like, well, what are all the sides of the story? Let's put it into context.
Yeah.
All of those things. And then, well, what's another way of looking at it, right? What are alternatives? Yeah. And it's not, what's the opposite? It's not that. It's, let's come up with 5 different ways, 5 different angles, vantage points of this. And again, I think everything's about getting unstuck. And I think that natural process helps me personally stay unstuck.
Yeah.